Okay, welcome everyone. I'm Rachel Houghton, and it is my pleasure to welcome you all here today to the first CDAC Network Members Forum at this wonderful space at the ICRC in Geneva that they so generously donated to us. The last time we were together for such an event, that was in London back in 2012 when the network had 12 members. And today we have 29 members and we are steadily growing. Our three most recent members are Insight Share, the Norwegian Refugee Council, and Plan International. Hands up, those from those agencies. Be brave. Yes, welcome. Now, for those of you less familiar with the CDAC network is a unique alliance between diverse organizations, which include humanitarian and media development agencies. On the humanitarian side, that's NGOs, Red Cross, and UN organizations. Also technology and other specialist service providers, as well as research-oriented organizations. Now, this forum is actually designed to allow network members and key partners to showcase new initiatives, discuss learning from the past 2 years, and explore new partnerships. It's an opportunity for us all to crystallize our ideas together, gather views, and identify priority areas for action, and all with regard to communicating with communities, which today you will probably hear shortened to CWC quite frequently. Now, CWC refers to initiatives that aim to support people affected by crisis, to access the information they need, and to communicate with the people they need to, including each other, in order to stay safe, access aid, begin their recovery, and hold humanitarian responders and governments to account. It should be a way of working that is everyone's responsibility. CWC initiatives, as you'll see today, can include specialist projects such as interactive radio shows, as well as communication that is incorporated as part of humanitarian programming, such as communication to accompany the move from blanket to targeted food aid, as well as different feedback activities. CWC approaches also make a point of emphasizing coordination to ensure that activities are as effective as possible. But more than this, CWC is about enabling affected people and local organizations to lead rather than to follow. This will require a culture and mind shift change on behalf of all of those involved in humanitarian assistance in order to place greater emphasis on listening so that we can facilitate, accompany, and enable. Thus, CWC holds the promise of empowering local people to have greater autonomy about how they put their lives back together in the aftermath of a crisis. Now, this forum is an opportunity for us to give credit to our network members and to key partners. I think it's all too easy sometimes to actually accentuate the negative, and we actually forget how important it is and also how inspiring it can be to learn from what's worked as well as what hasn't. Yet we, of course, have also asked those who are talking today to address the challenges and constraints that they face and to be honest about their failures. Operationally, from a CDAC network perspective, success would mean that communicating with communities is in everyone's minds as a priority at the beginning of any emergency. Having said that, though, and bear with me, all those CDACers, perhaps thinking about CWC as a priority for action and for funding isn't the best approach. If communicating with communities is going to become the way of working, then perhaps we shouldn't be thinking in the language of priorities at all. If we do, it might mean that communicating with communities, listening, enabling, accompanying, can be deprioritized in agencies' plans and in donor funding instruments. And what we're saying, simply, is that communicating with communities is non-negotiable. It needs to be absolutely integral to the way that everyone works and not some kind of optional nice to have. Now, in order for communication with communities to become the way of working, much more does need to be invested. We are hugely grateful to DFID for supporting the CDAC network over the past 2 years with a core grant and more recently with investment of $3 million from their Disasters and Emergencies Preparedness Program, or DEP. This will enable the network to focus on preparedness in 2 countries, Bangladesh and South Sudan, as well as strengthen global mechanisms such as the network's foundation training on CWC. This is incredibly welcome, and we are hugely grateful to colleagues at DFID for your leadership in this area of work, and there is an urgent need as well to take these efforts to scale. Now, before I finish, I would like to share a personal anecdote with you. I first became involved in the humanitarian sector about 17 years ago. You can see my crow's feet. Prior to that, I'd been living and working in South Africa, basically working in townships alongside township colleagues on issues around social and economic justice. Now, call me naive, but when I joined the humanitarian sector, because that's what it felt like I was joining a bit of a club, I was really perplexed by the emphasis on the material and the logistical, and the lack of connection to longer-term development. It all felt overly technical to me, and lacking in the kind of politics and person-centered approaches that I felt really mattered and should be at the heart of the way everyone was working. And I remember thinking to myself, what if we actually used the term humanitarian? And would that make a difference to the way that people were actually working? Now, we live in a precarious world, I don't need to tell you that. We live in a globalized world where nothing seems to have boundaries. This manifests itself in all sorts of ways, in the consequences of climate change, in the mass flight of human beings, and in issues like land occupation. Now, these are really complex or wicked issues. Yet, as Einstein said, we cannot solve problems using the same kind of thinking that we used when we created them. What we need is nothing less than a transformation in our way of tackling these problems. It's not just about what we do, but it's about how we do it. Yet transformation calls us into a place of not knowing. And as human beings, we don't like not to know. This will require courage, trust, and above all, dialogue. And we must ensure that we don't have the answers before we ask the questions. I'd like to suggest that systems thinking and networked approaches will be core in tackling the challenges that we face. Now, this is because I think we need to think creatively about the solutions required, and creativity is dependent upon us making new associations, taking shared risks, and learning together, all of which are encouraged by the meeting of different perspectives that take place in networked environments, such as this meeting today. But perhaps more importantly, we need to get beyond the technical and managerial approaches and surely think about how we actually engage with our fellow human beings. Now, this is why I think the CDAC Network's agenda, while seemingly a simple one, meeting the information and communication needs of people affected by crisis, is potentially profoundly transformative. Unless we support and enable people to make their own decisions, even about something small left in their lives in the context of a crisis, then I'd go so far as to say that we're actually not behaving in a humane way. Being able to make decisions is critical to people's sense of personal power and inner resilience, and surely our job is to do what we can to strengthen and enable that resilience. Why? Because those affected by humanitarian emergencies are at the precipice of human calamity, and as global inequality increases, such people are going to find themselves affected by crisis again and again and again. Therefore, supporting communication and connectivity with and between communities has to be an absolute priority. Now, in this slide, the opportunity afforded by the World Humanitarian Summit is really very important, and I'm delighted that we have some WHS Secretariat colleagues with us here today. There's much coming out of the WHS consultations that actually chimes with the CDAC Network's vision and approach, including, first and foremost, shifting the power to place affected people at the heart of response, developing more responsive and accountable models of response, and also localizing efforts and focusing more on preparedness. Now, those of you not involved in the donor side event later today will have an opportunity to talk about the CDAC Network's formal submission to the WHS. In parallel, a small number of us, and you know who you are, will talk to our partners in the donor community about how we can create a more favourable environment so that CWC isn't simply another technical add-on, a nice to have or an optional extra, but becomes the fundamental way of working, with the adequate investment of resources to make this happen. I'd now like to hand over to Yves Daccord, Director General of the ICRC, our very generous hosts. I think we've all been enjoying our time in the Humanitarian and in your surrounding building. And just to say that your colleagues have gone above and beyond in the support they've provided, so we are truly grateful. Thank you.
Thank you very much, Rachel, and good morning to all of you. I'm Yves Daccord. I'm the Director General of the International Committee of the Red Cross. And you know, first of all, I wanted to welcome you, of course, officially in our building, to tell you how proud we are to have you here. But as you know, there is no free speech. So it's a great chance for me also to have you here. You know, we locked the door and now we have a bit of a time to discuss. And look at me, I'm a leader and a manager of an organization, an international organization, and I have several requests to you as a group. And the first request maybe is something which is also somewhat to me too. And Rachel, you mentioned that. When we talk about community engagement, we really have to make sure, all of us, that we move from what is sometimes perceived as a buzzword, something which is slightly a side of organization, important, but, you know, we're all doing that for a long time, somewhat. So something which is at the core of our organization. And maybe for you it's obvious, but I can tell you within my organization, and some of my colleagues know that when we talk about community engagement or engagement with beneficiaries, whatever the word and the jargon we use, some people will think, yeah, but we're doing that since a long time. So what is now different? Why are we doing that? And my message to you and my request to you is we need to make our case much more clear. You talk about the World Humanitarian Summit, that should be the priority of the World Humanitarian Summit, not one issue. Why? Because the world is changing. Because the gap between what we propose as a response collectively and the needs is huge, bigger than ever. And right or wrong, we all know that we are not the only responsible for that. We know that we're living in a world where sadly there is no international convergence to propose political solution. We know that, and it will not change. We know Syria will go on for the next 5 years. We know Middle East will be under fire for at least the next 10 years. We know that Somalia will not be resolved. We know Sahel will be off limit for all of us. We know that, right? But we have to be aware that people are looking at us also as somewhat having responsibility. So how do we deal with this gap? How are we able to understand, try to explain what is happening in this world? And I think the only way for me is that we have to increase our ability to engage. Really. And seriously engage. Taking maybe the risk to engage. And we have to talk about risk. It's not just something that we do in Geneva or in London or even in Damascus. It's something that you do in close proximity. You find solutions, try to be there, really. It's critical. And I'm of the opinion that in the years to come, people will not expect only humanitarian services and response. They will also expect and will judge us regarding the quality of the engagement, our ability to listen, to change also the way we operate. And they will measure us not only are we good or not, do we have the right platform and the right techniques, but are we ready to really respond to their needs, their coping mechanism. We are aware of that, not a surprise. But how to do that, how to integrate that really within our programming, that's critical. So my first request is let's make sure that community engagement is not perceived as a communication tool or actions, but as a programmatic challenge, central to the way we operate. We know, you know that, I don't need to convince you, but how do you, as a network, how do you convince me as a leader and make sure that me as a leader, I'm able to bring that in my organization? And that's critical. I'm also the chair of the SCHR, which is a group who brings a lot of NGOs, international NGOs and the ICC together. I'm also part of the ISC. We don't speak about community engagement at the top level. I can tell you. Why? Why do you don't influence me to do that? You should. We should. And I'm committed to do that. but not just to say a buzzword. How do we do that seriously? I think it's a critical one. So that's the first element, first request. And it's a collective request to you, but also to me, right? I'm part of that. My second request is, could you please, and I like what you said, Rachel, we are dealing with a very complex world. We don't have to explain that. And I really have seen some enormous progress when it comes to community engagement in some contexts. It's very true, absolutely. But I still see some major challenge when it comes to, I would say, protracted, complex environment, especially when there is violence, war, where the information ecosystem is even more complex, even more political, even more difficult for communities, where government, but also non-state armed groups, manage extremely well community engagement on their own way, right? We are not the only one to do community engagement, by the way. I hope you really look carefully what Islamic State is doing. You can like it or not, right? It's very powerful, the way they are managing that. You can like it, maybe let's not call it engagement, but, you know, they're talking to their people. And what impressed me over the last 10 years is how much non-state armed groups have learned to do that. We as an organization, ICRC, we have learned to engage people through digital, not because of communities, it was because of non-state armed groups. In Somalia, Twitter, we discovered Twitter through the Al-Shabaab. They challenge us through Twitter. I mean, if you challenge you through Twitter, you have to respond on Twitter. No other choice. So this reality is with us for a long time. So what I'm saying to us is, let's also be real about the world in which we talk. It's a complex world. Let's recognize that we have worked a lot in natural disaster and improve. But the real world is, let's talk about conflict. Let's talk about a world where the government do not always occupy and control all the place, where it's complex, where the ecosystem of information is very political. So how do we really capture what community engagement means in this context also? This is critical for me. It's also critical because what I've seen is these communities have changed themselves remarkably, even in the worst situation. Somalia is a good example. Somalia, it's very clear that today, if you look at aid overall, I would say the formal humanitarian actors, we provide possibly, what, 30, 40% of the aid? The rest come through diasporas, smugglers, business, piracy, whatever. It's maybe not impartial, not always human, but it's there. How do we capture that? How do we capture the fact that people are connecting, judging? They're looking at us. They are changing. They have opinion about us. So engagement is not just to be cool, but it's also agree that you have very difficult discussions maybe on your own services. How are we ready to get the TripAdvisor factors, which will hit us once? I don't know when, but it's happening, right? So there is something happening, and I think we need to make sure that we don't only look, and I was happy, Rachel, to hear about empowering local response. It's critical, but let's also agree that it's not one or the other. It's and. How are empowering the local response, but also making sure that the international footprint is there within the crisis. What worries me is we are on our own. I have no coordination problem. I can tell you in Yemen right now, no coordination problem. Zero. Relaxed. Syria, outside of Damascus, really little communication problem. Afghanistan, really zero coordination problem. So the reality is, I would say, how do we do that in this very difficult context? So my request to you and to this network, and my commitment is to be able to work with you also on the difficult issues, on the critical issues, on our world, our real world. That's a second request. And my third request, and this is something which I found extremely positive about this network, Rachel, and this is one of the reasons you will see ICRC very committed. I think we've been, and I know some of my colleagues, I see Dennis and other people which have worked with us over the last 10 years, we've been, rightly so, in the humanitarian sectors, mainly focus, sometimes obsess about coordination. Rightly so. There is an expectation that we coordinate. With slightly problems, as always, we have spent a lot of time of coordinating our ambition, a bit less about coordinating the real capabilities on the ground. But that's another story. What I'm saying is what I think we should move on is, let's of course, coordination is important and we will maintain an important focus on coordination. But what I'm hoping is that we move also from coordination to collaboration. The key word is collaboration. And again, Rachel, I was pleased to hear that from you. What we value in this network is our diversity. This is great. Different perspective, different way to tackle that. And I'm really convinced about community of engagement. If we really want to engage people, communities, with their differences, with their complexities, we need to be able exactly to capture and harness our diversity. Collaborate on what works, on the best practice, found common ground when there are common ground, really understand also diversity, try to find and use what is happening in terms of new technology, but also old technology. I think there is a lot of old technology which already is quite impressive. So the collaboration part seems to me an extremely important element, and I think we should really keep on that. And making sure that this network, as you mentioned, will continue to be diverse. That's very important for me. Connecting, bringing maybe different people, different view on that one, which I think is absolutely central. So expect us as an organization to be with you, to contribute as much as we can, with our limits also, with our failures, but also what we're trying to achieve. We are worried about the world in which we operate, but we care about the world in which we operate. And we think that the community engagement is absolutely central to what we can propose to the communities and the people affected by war and by disaster. So thank you again. Thanks to be with us, really. Pleased to join you. And also thanks, can I just maybe last, Rachel, a word to you, Secretary, you people, but also to my people. Great, well done to have established, make sure that we have this event here in Geneva. Thank you very much.
Those who don't know him, I'd like to just introduce Nigel Fisher, who is giving our keynote today, and we're really very pleased that you're with us, Nigel. Thank you.
Thanks, Rachel. Very good to be with you, and I hope you'll feel the same way when I've talked through to the coffee break. I have been part of the humanitarian plus world for many decades. I've left the UN several times, but I think for the last time last August. And now working in the world of innovation, in the world of futures, but still associated with the humanitarian domain, but more and more how it links in with a range of other areas where we can't silo ourselves. So I want to talk to you about some of the issues that are coming up with the World Humanitarian Summit. You'll have a session this afternoon, but I'm doing some work with the Secretariat. And I think that there's some big issues which really align with your own aims and aspirations, and I think it's worth talking about those. But to start off, a few of you yesterday told me that you're worried about how to situate CDAC at this core of humanitarian action. So let me say right away that I think you have the winds of change on your side in philosophy and approach, and you are, and should be, at the very center of the tectonic shifts that are beginning to take place and that need to take place in the humanitarian world. And above all, the shift that will see affected people and communities in the midst of crisis better able to help themselves and to survive and better determine their futures. This is not new language. We've been hearing it for decades. But frankly, it still is not happening. And I think we have to look at that issue. So you're amongst some of the like-minded here. But what about out there, wherever there is in the ISC or in the field? You're a handful of communicators in a very big crowd. And seems to me one of the principal challenges you have is how to stand out. How do you communicate what CDAC and CWC are? And what's your message to those who want to listen, and even those who don't want to listen, to those who you want to support? Is your message compelling? Is your strategic intent clear? I'll talk, as I said, briefly about some of the themes that are coming out of the WHS consultations, and you're aligned with these. But I think, again, others need to see that alignment. Who's out there to support you? And I'm hoping this will be a central part of your institutionalization discussion this afternoon. I was happy to, when I was in Haiti as the humanitarian coordinator, resident coordinator, and the deputy in the mission there, I was happy to support CDAC's ground initiative there in 2010 and 2011 to work especially on communication around cholera. It's because I felt then and still do that CDAC aligns with my own perspective, my own vision of affected people and local people increasingly being able to take control of their own lives and determine their own futures and be in the driving seat. But going beyond survival and also being able to look to their futures, to prepare for a better future. I think there is also need for system-wide, and I take Yves' word, collaboration as well as coordination when it comes to communicating between humanitarian actors with communities in need and so on. And in Haiti, CDAC played that role within the local coordination structures, and it was in the lead in the cluster system on cholera communication and outreach to affected communities. And it was unfortunate because of that hairy question of finances that CDAC had to wind up earlier than it could have done. So now a few questions, starting with then why CDAC and what is CDAC? And why should its message be at the heart of the humanitarian dynamic? Well, as you say, it's a growing and increasingly diverse network. But then frankly, as I look around the room, I would ask, is it diverse enough? And does it need to be much more representative of the global south than it is today? And if so, what do you need to do to achieve greater inclusiveness? I think it's an important question because it's one that faces the whole established humanitarian club, which is still predominantly a northern club or a western club, built on a model that is frankly increasingly outdated, and in which charity still overshadows solidarity. However, we much protested that fact. It is still a charity-based model. We from the outside are helping poor folks on the inside, top down. A lot of us claim, no, we have a solidarity approach, but frankly, it's still not there. And it's true in the IASC, and it's true in the coordination mechanisms that still predominate at field level. And what's the message of all of that? We're here to help you poor victims, you beneficiaries of our largesse. And I'm going to come back to that a little more. Another question, what about decentralization? It's interesting that the WHS consultations are coming out very strongly that the IASC club has to open up. And one significant way suggested to do that is to decentralize today's very centralized humanitarian decision-making processes. For example, to regional committees which are heavily populated by regional and national organizations. And if the club is not to be ignored by the very people that the old humanitarian club wants to bring in, we have to think through differently. The trouble is, not everyone on the outside wants to join the club. Maybe they want to develop their own clubs. They're also suspicious of our self-perpetuating practices and motives, and they have other ideas. So in this kind of context, then, how can CDAC provide a model of true north-south local external inclusivity? And remember, I'm not talking about what you believe, because you're all convinced, but I'm talking about how are you going to persuade others? How will you, the communicators, communicate with others? Now, on to the next issue, the self-imposed humanitarian bubble. There's a very strong perspective within, but even more so beyond the known world of the humanitarian community, that humanitarian action is too much contained in a bubble, and as I said, in large part, a self-made bubble. And those who see this say that humanitarian action can't be siloed in this way. It can't be separated from resilience and recovery and development strategies, and that in fact a resilience mindset must be at the beating heart of humanitarian action. And we have to emerge from our silos and collaborate with and talk to a range of other actors, the private sector, the people focused on governance issues, people in the financial community, in science and technology, and, as Yves said, in the political world. They're all part of our world too. So, question again, is the CDAC network prepared for that alignment? Do you believe it? So once again, I come back to this question I think it'd be important for CDAC folks to reflect on. Why is CDAC worth supporting? What's the case you can make? What is its vision? What is its value? What is its impact? And how do you articulate these to those who are not part of the network? What does CDAC deliver? And how to measure impact or success? Is it to have succeeded in opening up lines of communication between communities and the world outside? Or is it to see communities and national actors increasingly managing their own crisis response and recovery? How you ask the question defines how you define the impact. Is it to have identified ways to help local groups go stronger? Is it to have helped move external actors from direct service delivery role to more of a supportive role? Subsidiarity is one of the flavors of the moment, and subsidiarity of international humanitarian actors. Again, that principle rings out again and again in the WHS regional consultations, which are just now coming to an end. So how is what you do and say perceived by others? And again, is the CDAC network clearly communicating your core belief that it's about people on the ground struggling to put their lives back in together and hope for the future? It's not about us, the aid community. Well, then let's look at some of the wording that you use, and let's look at that sacred phrase, communicating with communities. Well, frankly, if I just look at that cold, it still implies to me a rather traditional view of the world, outsiders looking into communities. So what about communicating within communities? What about communicating between communities? What about helping communities set the terms for communicating with outsiders? On whose terms is communication being undertaken? I think in the meetings yesterday and also in the CDAC documentation, it's very clear that you're committed to affected people and communities taking charge of their lives. But for those who don't read the fine print, that phrase, communicating with communities, maybe doesn't tell the whole story that you want to tell. Your own materials refer to, quote, communication between aid actors, I assume external, and disaster-affected populations as one of your core approaches. That's from your Haiti Learning Review. Well, frankly, to many that might sound like a pretty old North-South paradigm. We on the outside are the helpers. In the communities, they're the victims, the beneficiaries. I don't think that's the message you believe, and it's not what you want to deliver. So I think even what are the phrases, what are the terms we use determines how we can articulate a message. I think you all know that complaints are often long, loud, and frequent from affected people, local actors on the ground, local organizations, about how they're patronized by outsiders and how internationals interact with communities. A couple of examples from my own experience. In Haiti, a frequent long and loud lament from local organizations, peasant groups, and so on, that externals are not in sync with their cycles and their rhythms. And I heard it many times. You outsiders engage with us on your terms, with your deadlines, your budgetary constraints, and your mandates and your jargon. But apart from that, we're perfectly aligned. One Haitian famously told me that, you know, Haiti is littered with the bodies of successful projects that you folks initiated and funded, and when your drive and your money went away, we really didn't see much point in continuing. There's a deep distrust of the outsider. Displacement of local organizations and actors and capacities is often a feature of international humanitarian interventions. And in trying to support local, we steal staff from community organizations and local NGOs and private enterprises, even from the government. If I look at healthcare in Haiti is predominantly private sector. After the 2010 earthquake, Obviously, many hospitals, health centres have been damaged, but quite a lot were still functioning. Within 3 months, most of those were out of business. Why? Because with the best of intentions, the external world came in providing free healthcare, and we didn't look at this fact of how could you maintain local action in health, but at the same time, maybe it's through subsidies for a short time, make sure that health institutions can continue, but people in need can get access to free quality care. We dove in, and as a result, weakened capacities of partners that we should have been strengthening. I'm working now with a group of community and family organizations under an umbrella called Fumble Talk in Sierra Leone. Very interesting. And they recently expressed the view that the international response to Ebola felt like a second colonial wave. We have to think about that. For more protracted emergencies like Syria, where I was for a year, 2013, 2014, I had a group of people working on how do we help local Syrian organizations, private sector, local councils, start to think about getting more access to local resources. How frustrated they were to say the only way we can get access to the resources is if we subcontract to an external organization, usually to an INGO, on their terms in our communities. So something's got to change in that. So it seems to me the top-down north-south model is very much alive, the charity versus the solidarity dynamic. But I think it's getting old, its arteries are hardening, and I think a heart attack is on the horizon. So at the risk of overemphasis again, the light at the end of the tunnel is the light of an oncoming express train, and that's, if we want to give it a name, is the express train of localization and subsidiarity. Horrible words, but to explain them takes a long time. It's a shifting of power, which requires a shift in the mindset of external humanitarians, moving from being in charge to being supportive, accompanying as a friend and colleague, not directing as an overseer. Again, back to Haiti, February 2010 in Léogâne, the epicenter of the earthquake. Some of you who were there might have met the mayor, who was going absolutely ballistic about the number of organizations in his town who he knew nothing about, who never consulted him, and were handing out stuff. And he said, for God's sake, he said, we Haitians are very proud. We are not beggars. We'd appreciate a helping hand, but we don't want handouts. And there's a world of difference there, which has made me think many times. And I think even in the worst of times, if we're looking for local partners, you can always find local partners. In '94, during the Rwanda genocide, I was the UNICEF special rep for Rwanda and the Great Lakes. And I remember when the wave of refugees went to Eastern Congo, asking my UNICEF colleagues, when you're looking at local implementation, water, sanitation, etc., look for local partners to work with. The response was, oh, they don't exist, we don't have time, and we went to our usual international NGO colleagues who did a great job, but it wasn't hard to find women's groups, church groups, community groups who were running schools, health centers, pharmacies, you name it. There were partners there waiting to participate, but somehow we didn't have the time or the knowledge to look for them. So, okay, local and national leadership, affected people, determining their own destiny, etc., with appropriate help from the outside. I guess the question is, so how to localize? Well, actors from the outside need to know and understand local dynamics, and they need to know that they are not working in a vacuum. And I really don't think that can happen if we leave it until we're actually parachuting in to a hot crisis, once it's actually broken out. Therefore, and what you're doing in Bangladesh and South Sudan, investing in preparedness is an absolute must. And preparedness is just not limited to that plan for the next earthquake, the next tsunami, the next cyclone. For an external actor, it means something more fundamental, which is to truly partner, and that means knowing the context, understanding the local actors, local capabilities, local ways of acting and doing things, as well as understanding the strengths and weaknesses of the governance, political and economic, social and community dynamics. And as I say, that level of knowledge and understanding can't happen just as we're parachuting into the midst of a crisis and chaos with little or no knowledge of the place into which we're diving. So without preparedness and without understanding of context, then the international community won't know who to work with locally, will not know that there are local leadership and coordination structures, which we should be supporting rather than displacing. I think, and as I say, I think the work you've started to do in Bangladesh and Sudan is an important recognition of that. I think none of us can communicate with communities in a knowledge vacuum. And it's not what knowledge we bring to the table, it's the knowledge of the situation on the ground. And the nature and the objectives of communication have to be determined by the context and the conditions specific to each different context. And which, again, by definition, leads to a differentiated response in every context and not the same approach wherever we are. We're often accused in the humanitarian community of trying to apply one-size solution to fit all. It doesn't work. Now, a word on innovation before closing. In the communication world, technology innovation, as we heard yesterday, is breathtaking in its speed, and we need to keep abreast of innovations and see how we can exploit them. And we heard some very exciting innovations yesterday afternoon. And I'm involved myself with a couple of game-changing startup enterprises which are building on scientific and technological information on robotics and nanotechnology. It's heady stuff, but as was also pointed out yesterday, innovation is just not technological, it's also a state of mind. It's not accepting business as usual, it's focusing on solutions and not problems, it's thinking out of the box. And you might think that's obvious rather than innovative. But I challenge you to think of the many situations you've been in where people get stuck on the problems, on why things can't happen or won't change. And in crisis and in disaster and armed conflicts, outsiders are there because of the problems. If there were no problems, we wouldn't be needed. So we can't get stuck on them. So we're there to help with innovative and creative solutions. And if we can't contribute those, we should get the heck out of the way. So in our increasingly disaggregated and diverse and divided and multipolar world, it demands innovation of thought and action as well as technology. Okay, let me conclude with a few points, just to summarize. First then, the CDAC network and your philosophy and approach, I think, are very much in line with the big changes, the programmatic changes that need to come in the humanitarian world. Solidarity, not charity. The agency of affected people, strong national, local leadership. The subsidiarity of external actors, i.e. we need to support more and do less directly in terms of taking over. Perhaps our effectiveness and impact should be measured by the resulting strength of local actors and by community activism, not so much by how much stuff is delivered to so-called beneficiaries. Second, a challenge I mentioned for you, how to move to the center of the debate to show that communication is not an optional extra, but it's a non-negotiable. How to demonstrate that CDAC and its philosophy of communication and freedom of expression and the right to information, the right to be heard. This is what the wider community, humanitarian community needs, how to get that word out effectively. Third, I mentioned inclusion. There are many new players out there with various degrees of interest in working with the old club. So is the CDAC network the old club or something different? Hopefully something different, I think it is. Fourth, this issue of knowledge of context. It's key to the ability of those from the outside to accompany, and that word accompany is very important. Accompany affected people and local actors to take control of their own lives and destinies. And that knowledge can't be adequately developed once all hell breaks loose. Fifth, institutionalization. It's a big issue for you. And I assume that you'll be grappling with this afternoon. If I put my old UN hat on, I'd say that in every UN coordinator's office, I don't see why there couldn't be a communication and local partnership advisor. Maybe that's a CDAC advisor. So I think you could help push that along if you were ready with a roster of humanitarian communication and media people. But I think, again, that roster has to go well beyond the traditional suspects, the traditional humanitarian and media development club. New members from the Global South are key. And then sixth and finally, I think there's a great question that you can pose to fellow actors, especially the internationals, in the midst of a humanitarian crisis response. And that is, so if you're not working with and for affected people and affected communities, then who exactly are you working for, and who are you working with? And keep on hammering away at that until you get real concrete answers. So with that, good to be here, and thank you very much.
Thank you.